Hello, everyone. I'm Dr. Siddhaya Subramania. I'm an upper GI and general surgeon. Today, I'm going to talk about the new IFSO guidelines that has been introduced in 2022. That is the International Federation for Surgery for Obesity and Metabolic Surgery. This has great impact on the patients who avail this treatment, but also on the GPs and specialists who actually prescribe this treatment and put their patients through the procedures. So what were the guidelines in 1991? It mandated that the patients needed to have serious attempts at medical weight loss before embarking on surgery. They needed to be a BMI or a body mass index of more than 35 with some comorbidities or medical issues such as high blood pressure, sleep apnea, or diabetes. Or they needed to have a BMI of more than 40. There were no special considerations for specific medical conditions such as transplant or any other bigger surgeries that needed to be done and they were not able to be done because of obesity. So what IFSO did was they looked at all the literature and the research that were published in the last 3 decades and came up with the recommendations, not only with regards to the procedure type, but also the indications for the bariatric surgery, as well as expanded indications, and one of them being the age limit cutoff. The current practice shows that majority of the procedures that are being done are laparoscopic sleeve gastrectomy or laparoscopic Roux-en-Y gastric bypass. They encompass about 90% of the practice. The others include one anastomosis gastric bypass, which is gaining traction, especially in Australia, and biliopancreatic diversion or duodenal switch, which is mainly popular in Europe and US. The historic procedures which are not done anymore or very rarely seen are vertical band gastroplasty and laparoscopic adjustable gastric band, mainly because of the complications involved with those. So what do the new guidelines say? If a patient weighs more than, or if a patient has a BMI of more than 30 and has a comorbidity or a medical issue such as diabetes, sleep apnea, high blood pressure, they qualify for bariatric surgery. Or if a patient is more than 35 BMI, with or without any of these medical conditions, they qualify for bariatric surgery. In terms of the BMI cutoff, it has been reduced for Asian population, and anywhere above the BMI of 27.5 is considered as overweight in Asian population, and above the BMI of 32.5 is considered as obese. In terms of the expanded indications, the age limit doesn't exist anymore. Largely speaking, anybody who over the age of 70 is still eligible for bariatric surgery as long as the risk and benefit is weighed out properly and the frailty has been assessed. That is, they have been deemed fit for surgery, because obesity is a major surgery and it needs to be dealt in such manner. In terms of the children and adolescents, if they have a BMI of more than 120% of the 95th percentile for their age and have one or two medical issues, such as, again, diabetes, high blood pressure, kidney disorders, heart disorders, or sleep apnea, they qualify for the surgery. Or if they have a BMI of more than 140% of the 95th percentile for their age, without even having any of the comorbidities or medical issues, they qualify for surgery. The new indications that have been put forth is in relation to major surgeries that wouldn't have been done because of the obesity, and they were difficult to be done or they had bad outcomes. And they include joint surgery, and it mandates that the obesity surgery needs to be done at least about a couple of years prior to considering joint surgery to have the best outcome. The other two areas where obesity surgery will have a positive outcome leading to major surgeries are abdominal wall hernias, or otherwise called as ventral hernias, and transplantations. Now, all these expanded indications need to be considered carefully. These need to be embarked on in a multidisciplinary team approach and in a tertiary center, ideally where you have support of other physicians and other specialists, especially when it comes to patients who are being put forth for transplant and they need bariatric surgery. But at the same time, expectations need to be set because a certain BMI requested by a specialist may or may not be achieved following bariatric surgery. So the other expanded conditions are where the research shows that bariatric surgery is still helpful and relatively safe is in patients who weigh or has a BMI of more than 60, patients who have liver disorders such as cirrhosis, and patients who are on the waiting list for heart transplant who have an artificial heart to keep them alive. Again, all these need to be taken into consideration after assessment by multiple specialists rather than just considering the bariatric surgery on its own. Finally, surgery and lifestyle together is what leads to success. Surgery, our bariatric surgery, is a tool that we can use or misuse, but ideally, if we use it in conjunction with alteration of our lifestyle, it leads to the best outcome. Thank you.